social caseworker. Introduction. This lesson is about understanding the role of caseworker. In this lesson, the role of caseworker in different settings is discussed. Objectives. After the completion of this lesson, you should be able to know role of caseworker working with special groups, skills needed by caseworkers, techniques used by caseworkers in treatment. Role of caseworkers. Social work profession promotes positive social change by solving problems in human relationships, empowering and liberating people from the hopeless condition so that they may enhance their well-being. Utilizing theories of human behavior and social systems. Caseworker intervenes at the points where people interact with unfriendly environments. Principles of human rights and social justice are fundamental to social casework. Broadly speaking, caseworkers try to help people improving their surroundings and their relationships and also enabling them to withstand their struggles. Many caseworkers deal with people who face life-threatening situations such as criminal activity or substance abuse. Other issues that caseworkers try to address are inadequate housing, unemployment, illness, disability or difficulties around childbirth. To achieve the objective of casework at different times, the target varies. It may be client or environment or both. The purpose of casework is achieved through application of professional social work values, principles and practice of methods. Caseworkers may, for example, confer with individuals and families, enabling them to deal with stress and resolve interpersonal problems. Caseworkers offer valuable support and assistance to people in need. They might help clients with concrete needs like housing or food, or help them apply for social services. They often work with people who are unable to care for themselves or their families because of mental or physical illness or disability. Caseworkers are categorized as social workers by the Bureau of Labor Statistics. Skills needed in dealing with the multitude of problems those social caseworkers address. They must employ a variety of skills depending on the job that needs to get done. Some of these skills are active and effective communication, listening, social perceptiveness, logical thinking, coordination, writing, reading, comprehension, problem solving, decision making, etc. Work environment. Caseworkers work for employers who try to ensure that specific physical, psychological or social needs are met. They might work in healthcare institutions such as hospitals, mental health clinics, nursing homes or assisted living facilities. Caseworkers might also work for community organizations, government institutions and humanitarian organizations such as child welfare or immigrant or refugee service agencies. Understanding of the problem. Social caseworker develop a preliminary understanding of the problem and of the client. He or she also provides psychological support and help to the client and engages him in a therapeutic relationship. It is quite possible that through this initial process of treatment, client may learn that he really does not need further help as the problem has been sufficiently clarified and explained. Motivation and role induction. A social caseworker at the beginning of treatment process is to build and develop the therapeutic relationship between himself and the client. Workers' empathy, warmth and genuineness feelings are highly motivating force for the client to take part in the therapeutic process. Caseworker always enhances motivation in client to continue the treatment. He or she also encourages client to specify his expectations of treatment and feelings about seeking help. He or she attempts to clarify the roles and responsibility of both himself and the client. Diagnosis and assessment. Diagnosis and assessment process are ongoing throughout the entire treatment. Social caseworkers provide detailed information about the problem situation that will help in establishing the treatment goal, a strategy of treatment and selection of specific procedures of treatment. The caseworkers assess the client's ego, strength, skillfulness, capabilities and capacities in relation to his problem. He or she classifies the excesses and the deficiencies in his behavior and selects the specific treatment procedures to be used to overcome the problem. He or she assesses whether the client needs advice, counseling, behavior modification, crisis intervention or consultancy services like teaching, consultation, interpretation, supervision or provision of adult services, that is material help, resource location and referral. Mobilization and utilization of resources. The client is extended help to choose and use the social resources afforded by the community. A social caseworker helps the client for an adequate knowledge of available resources through the techniques of discussion, information, clarification and direction. The use of services is essential to solve any kind of problem, and if the problem is of social nature, then it becomes more essential for the worker to help the client in this direction. It is the job of the caseworker to take the client to the resources. Environmental manipulation. Environmental manipulation means to bring change in the social conditions of the client so that he may be relieved from excessive stresses and strains. The caseworker suggests as to what step may or may not help the client to cope better with his problems. He or she plans with him as to his emotional, professional or recreational activities. He or she gives an appropriate advice to members of his or her environment and modifies their attitude affordably. A social caseworker organizes activities such as home service, camps, group experience activities, training and employment for their livelihood and other activities of adjustmental nature through which the client's experiences help in his personality, growth and adjustment in the society. In general, environmental modification is undertaken by the caseworker only when environmental pressures upon the client are beyond the latter's control, but can be modified by the caseworker. Counseling. Counseling is a personal help directed toward the solution of a problem which a person finds that he or she cannot solve himself and on which he therefore seeks the help of a caseworker whose knowledge, experience and general orientation can be brought into play in an attempt to solve problem. It always used for some particular purpose like marriage counseling, occupational counseling, family counseling, school counseling, etc. Therapeutic interviewing. Therapeutic interviewing is used where intrapsychic conflict is projected to the environment or neurosis or behavior disorders are acted out. The purpose of such interviewing is that of psychotherapy, which aims towards personality growth in the direction of maturing, competence and self-actualization. For the analysis of unconscious, social caseworker applies the techniques of free association, dream interpretation, analysis of resistance and transference. For behavior modification, social caseworker makes the use of the techniques of positive enforcement and negative enforcement, positive punishment, negative punishment, systematic desensitization and covert desensitization, and lastly clarification. It is also a kind of counseling through which clarification of clients himself, his environment and the public with whom he is associated is made. A social caseworker gives such an understanding to the client that he or she becomes capable of understanding himself or herself, his or her environment and his social network. Clarification may consist of giving the client information about the environment or people in the environment which he or she does not possess and without which he cannot see clearly what steps he or she ought to take. Interpretation, sometimes conflicting feelings and strong emotions leads the individual to distort reality so seriously or react it to so inappropriately that understanding is impossible without the deeper perception. A social caseworker interprets the factors of the problem, related facts, attitudes of client and unconscious feelings in relation to the reality situation. He or she helps the client to an awareness of his strong projection of his or her inner needs and his subjective responses upon the outer world. Psychological support. Psychological support is useful in decreasing tension and guilt, increasing self-confidence, encouraging healthy functioning or a way of functioning that maintains the client's equilibrium and in helping to build up compensatory strengths and satisfaction. A caseworker accepts him or her and his or her feelings and shows keen interest in client. He or she clarifies the problem and encourages him or her to take his or her own decision. A caseworker through psychological support does not develop understanding in the client but applies reinforcement for his or her ego strength through the techniques of guidance, reassurance, suggestion, persuasion and advice. Monitoring and evaluation. Monitoring provides crucial feedback to caseworker and the client regarding whether the treatment program is succeeding as desired, whether established goals have been achieved, whether modifications in the program are necessary, and whether the client is being helped in real sense. A social caseworker evaluates the content of the program and its effectiveness on inner strength gained by the client and his or her success in helping the client. Role of caseworker in working with special groups. Hospitals. Doctors are the main professional groups in hospitals responsible for medical care of the patients. The recognition of psychosocial and cultural dimensions of illness and hospitalization has enabled employment of trained social workers in the hospitals. Social casework is utilized in the outpatient departments, the wards and the special clinics. The heavy workload of doctors in large government hospitals generally leads to lack of clear communication between the medical staff and the patients and their families. In such a scenario, the main roles expected of social caseworkers are those of mediator, enabler, coordinator of services, case manager, mobilization of family, community and hospital resources, and acting as a member of the team of professionals. Working with the patient and his or her family is a major task of the social caseworker. Therefore, social casework is a primary method in medical social work practice. Institutions providing mental health care. The caseworker, as a member of the team of professionals including psychiatrists, psychologists and occupational therapists. Psychiatrists are the main professional group in charge of care and treatment of the mentally ill or emotionally disturbed person. The patients may be attending OPDs, daycare or may be hospitalized. The main tasks of the caseworkers are to maintain constant contact with the family of the patient, mediate between the doctors and the patient family, provide counseling to the patient, assist in discharge and aftercare of the patient. The worker provides the necessary support to the family and helps the other family members understand the needs of the mentally ill person. Working with the chronically, terminally ill. The patients who are suffering from chronic illness like diabetes, asthma and heart disease need help in understanding their illness and the demands of the treatment and adjusting their lifestyles to the limitations imposed by the condition. The families of the patients also need support and guidance in dealing with the patient's condition that may have long-term implications for the entire family. In some cases, especially among those belonging to lower income groups, the financial burden may need to be eased out by identifying and mobilizing resource in the kinship network or community at large. The role of the caseworker with terminally ill includes ensuring palliative care to reduce pain and discomfort, talking about death, involving the patient in planning for the family after his or her death, providing opportunity to family members to talk about death and dying, and providing support, emotional and material to the patient and family. Schools. Schools are institutions for formal education with a fixed routine, set syllabus and a well-established pattern of teaching and learning. Teachers are the main professional group and they spend the maximum time with students. Despite progressive and child-centered educational philosophy, schools are characterized by emphasis on syllabus, information content, formal examination system for evaluating their achievements, and formal teacher-child relationships. In this context, the child very often is not able to get his basic human and educational needs fulfilled. This situation proves to be stressful to the child. Due to preoccupation with syllabus and maintaining discipline, teachers are unable to individualize child's situation and there is a problem child at hand. Hence, there is a recognition of need for individualized social casework service to help the child. School, however, offers an excellent opportunity to caseworkers for offering preventive and promotive interventions beside remedial service. Transition of the child from entry to passing out from school coincides with the child's own maturation process. By anticipating the demands and stresses of particular age group, appropriate interventions may be planned so as to avoid necessary emotional turmoil. By helping in the development of the personality and life and social skills, the social caseworker can achieve the status of a partner in the educational process. Despite of its being a secondary setting of social casework practice, the worker can easily demonstrate the vital contribution of professional social work to fulfillment of educational goals of schools. The social caseworker works as a liaison between the family and the teacher. He or she acts as a mediator, enabler, teacher, giving necessary information, advocate to highlight the negative impact of school norms and practices on the child. Change agent for the school system and procedures and as a consultant for the staff of the school in matters regarding children's needs and well-being. Children's home. Homes run by the government or voluntary organizations are expected to provide custody and care to the children. A social worker is an important professional here. Living arrangements may be dormitory or cottage types. A social caseworker is expected to help each inmate adjust to the life within the home and achieve psychosocial development. As the children have often gone through traumatic experiences before they are placed in the homes, it is very important for them to come to terms with their life, talk about it and get over the pain and the sense of betrayal. The worker is expected to provide pastoral care, liaison with schools where the children go for education, help children develop positive relationships within the institution and prepare for life after the stay in the home is over. Organizations working with women. Social caseworkers are employed in family counseling centers, crime women cells, legal aid cells, family courts and women resource centers. The aim of the professional interventions is to enable women become empowered, confident and independent and also utilizes available legal provisions and safeguards for her protection. Caseworkers work for employers who try to ensure that specific physical, psychological or social needs are met. They might work in healthcare institutions such as hospitals, mental health clinics, nursing homes or assisted living facilities. Case workers might also work for community organizations, government institutions and humanitarian organizations such as child welfare or immigrant or refugee services agencies. Summary: the goal of social caseworker is to solve client's problems by developing his capacities and capabilities so that he may realize satisfaction and happiness. To achieve this goal, caseworker studies social and psychological conditions of each client and adaptation level and ego functioning to put a clear diagnosis for proper treatment. Write a note on work environment of caseworker. What is counseling? Write a note on role of caseworker in school. Write a note on role of caseworker in mental health care. Write a note on monitoring and evaluation. References: Gunjal B.S. and Ganga Bhushan M. Molankal, Fields of Social Work Practice, Bangalore, Baraha Publishing House. Mishra P.D., Social Work Philosophy and Methods, New Delhi. Inter India Publications. Manju L. Kumar, Fields of Social Casework Practice, Social Work Intervention with Individuals and Groups, New Delhi, B. R. Ambedkar College.